The following program is intended to educate the public on a variety of cosmetic procedures and is sponsored by Sonia Cosmeceuticals and Advanced Medical Grade Skincare.
Welcome to Health and Beauty with Dr. Sonia. I'm Sharon Coleman. I know we all have experienced dry, dull skin, and it really makes us look a lot older. There's hope. Dr. Sonia is here to help us turn back the hands of time. Hi, Doctor.
Hi, Sharon.
Now, what causes that dull, drying appearance that we have?
Well, this, Sharon, is one sign of having mature skin. So there are several reasons why our skin ages. Certainly, as we get older, what happens is our skin becomes more dry, thin-skinned, more susceptible to sun damage, precancerous spots, and also, more importantly, all these sunspots that we start seeing on the surface of the skin, those little brown spots, fine lines and wrinkles. And really what happens is, I brought a little prop here to kind of illustrate this. This is our first layer of our skin called our epidermis. This is our second layer called our dermis. And really all the havoc that's being driven by sun exposure, by genetics, all these kinds of factors is really superficial. So you get a lot of the sunspots that occur in the epidermal layer, the very first top of the layer, first top layer, as well as precancerous growths. And a lot of this is due to kind of intrinsic and extrinsic aging, so sun damage, smoking, genetics, facial expressions, all of these bring about aging.
So what can be done? And I have another question too. Are you saying that the damage is actually below what we normally see?
Yes. So there's a lot of even precancerous growths, for instance, which is very, very common. I see them daily, where you've had a lot of sun damage, especially more prominent in fair-skinned individuals who've seen a lot of sun damage in the years.
Oh, sure, yeah.
That's just kind of laying underneath the surface of the skin and hasn't quite popped up to the surface, and it takes several years for that to occur. And so the biggest thing that I see is people who are not wearing sunscreen, who are out there baking in the sun, tanning, using tanning beds. Those are the people that I see the most amount of sun damage and the most amount of aging.
What do you recommend that they do when they're having
there's several
problems like this on their skin?
There's several things that we can do, and I actually brought some before and after pictures that I'd love to share with you. So this is sort of a typical patient, kind of in their 50s, and an area where we see a lot of aging, kind of the jowling area, the turkey neck, and you can see that she basically had laser resurfacing done, where we were able to minimize some of those brown spots, fine lines and wrinkles, help tighten her skin, and that's basically what you can see in the after photograph, where you can see more of a well-defined jawline area, less lines and wrinkles on top of her face as well.
Less lines.
In the next picture here, we really focused on full face, but also in the eye area. So this is another typical place that we can focus laser resurfacing on, where you have lines, wrinkles, brown spots, and so you can see in here the tightening effect. There's less lines, less wrinkles. She just looks more rejuvenated and more rested.
She looks rested.
And very natural.
Very fresh.
In the next picture here, here's a patient that actually underwent a combination procedure, which is very typical in our practice. So she actually had some surgical procedure done, but what I really want to point out is the fact that she also had laser resurfacing done, where we were able to, even out her skin color, her skin tone, help with fine lines and wrinkles, and help with the tightening effect. And you can see how much younger she looks.
It's remarkable, and she has a glow too to her face. Not only are the lines gone, but I mean just the appearance of the skin.
And it's a very natural result. So she still looks like herself. She wants to look the best that she can at the age that she's at. She doesn't want to look any different or look like she's had some sort of a procedure done.
In a really non-invasive way.
Correct. And then the next patient here's a patient who's got more of those sunspots, which are very common, all from sun damage through the years. She had to wear makeup to cover this up, and isn't it refreshing to be able to undergo a procedure where you no longer have that brown spot? You no longer have to wear that extra makeup.
She looks
less makeup.
Great.
Right.
I think we've all suffered from that, and look at it's gone.
And the jowl area also is really tightened up for her, so she had a beautiful result. In the next photograph, we have a gentleman who wanted to get some fine lines and wrinkles, and he also had some acne scarring which is another typical patient that we'll see for laser resurfacing to help build up collagen. And you can see in the after photograph, his skin is just tighter, it's smoother, even texture, less of the acne scarring, less of the pitted scarring that you'd see in acne scarring. So had a beautiful result.
He looks terrific, and it also answers what I was going to ask you next, which is there are other reasons for this procedure other than reversing the hands of time. I mean, this fellow, certainly he wanted to get rid of the acne scarring that he had.
Right, and that's an important point because it does treat a broad range of problems. We certainly can help with the fine lines and wrinkles and the aging, but the important thing is we're also helping things that are medically related, such as helping to prevent precancerous spots, even skin cancers that might be laying low underneath the surface of the skin. And we can also help other medical conditions such as acne scarring.
So this is a real benefit to even just having the procedure done. If you're kind of taking care of a potentially cancerous situation, you wouldn't necessarily know.
Right,
that you
correct.
were having.
And a lot of times they'll come to me for more of the aging or anti-aging concerns that they want to address, but the nice added benefit is we're also helping other medical conditions.
How long of a procedure is this? Is it done in one day? Are there a series of treatments that...
It's relatively simple.
Okay.
It's a one-time treatment. It takes about a couple of hours and pretty easy to undergo. There's several patients that have undergone it with beautiful results. And the nice part about this procedure is it's going to be a more longer-lasting result, and you'll continue to see that improvement over time, over 6 months actually.
Do you combine this then, or would you recommend combining this procedure with another procedure?
Well, I think it varies depending on the patients and what their goals are. And certainly our big things that we do in our practice is combination procedures, because I work with a plastic surgeon who can do more minimally invasive procedures or something more surgical, and then they come back to me to help with more non-invasive procedures. So if it's something about helping with the jowls or the turkey neck area, we can do contouring procedures along with laser resurfacing, and certainly we can address the face. We can also address the neck and the décolleté area with laser resurfacing, because this is really the areas that are most prone to sun damage, as well as precancerous spots.
Sure. Now, I know all the viewers are going to want to know, and I know I certainly do, is this procedure safe?
It's absolutely safe. There's anywhere from, downtime can be anywhere from 2 to 5 days, but it is a very safe procedure in the right hands with the experienced, operator, the surgeon, the dermatologist that's performing this procedure. So I think it's important to always research that information, but it is a very safe procedure in the right hands.
So a patient coming in really shouldn't feel worried or anxious about having the procedure done, because I know when you're having anything done, there's always that element of wonder.
Absolutely. And I think what's helpful is the fact that it is done in the office under local, so it's all topical anesthesia. There's really nothing invasive about this procedure. You're done in about a couple of hours. The procedure does take about 2 to 5 days for full recovery, but you'll start seeing the benefits immediately, and we'll continue to consistently see that gradual improvement over time.
And seeing the benefits is something that we'll be able to actually see in the next segment, which is coming up. So stick around for more health and beauty with Dr. Sonia. We're going to get a chance to actually see this procedure performed. Stick around, we'll be right back. If you have any questions for Dr. Sonia, please visit EliteMDSpa.com. Click on the link for Health and Beauty with Dr. Sonia. We just may answer one of your questions on our upcoming segments.